This is my on-call notebook for cognitive linguistic disorders. I started off with a paragraph that says, this notebook contains activities for the 5 domains of cognition to address impairment in each of these areas. The activities specifically address a multicultural perspective because each activity can be modified to best meet the activities of daily living following an interview with the patient and caregiver. I started off with some assessments that can be used for each of the 5 domains. This first one is a full cognitive linguistic assessment, and the parts that although it does address expressive language, I like the 2-step demands, as well as the yes and no questions and some of the categorization, verbal sequencing, problem solving, inferencing for deductive reasoning, and then some of the short-term memory things. The MOCA I included just as a basic screener for each of the 5 domains, as well as the slums. The RIPA I included because you can give the subtests separately, so there's areas for memory, as well as orientation and problem solving, reasoning, organization, thought organization. There's no visual spatial awareness, but it addresses many of the domains. And then the crash inventory, again, it addresses each of these areas, especially spatial orientation, temporal orientation, general orientation, problem solving, abstract reasoning, inductive and deductive reasoning, decision making, visual scanning, so this has more of the visual spatial awareness that the RIPA does not have, mathematical reasoning. Oh, and here's another full cognitive linguistic assessment. Okay, so my first tab here is attention, and I've included a resource from the Executive Function Disorders book, and it just talks about each of the different attentions. So you have things like selective attention. I put down basic and higher activities. I do have some handouts, but these are things that you can kind of just make up on the spot, like for basic, selecting one letter and listening to that specific letter when reading, or a word when reading. Also, you can listen for the traffic reports while brushing your hair, or just something like that. A higher level would be following a conversation, ignoring others talking, counting change in the store, doing any kind of task when there's distractions presented. Here are some more activities for that. So that's selective attention. We also have divided attention, which is doing things at the same time, like making dinner and answering the door. This is more alternating attention, I guess, and then going back to dinner, or making a salad while cooking the chicken or the rolls, and making sure that both of those things can be done. And although that's really functional and might not be able to happen in therapy, there are things that we can work on, like generating a list of tasks that they can do at home, and then being interrupted by questions that the clinician presents. Again, alternating attention would be following some kind of cancellation task and then having the clinician ask a question. You can also do it with math equations. Divided attention would be that multitasking, like I was saying before, talking on the phone and making dinner. And here are some ideas for divided attention: listening to the weather while taking a shower, making coffee and making toast, driving to work and listening to a voice message, things like that. So you can, the iPad under Constant Therapy has voice messages you can listen to, and you can have them do some kind of visual task while they're doing that, just to work on divided attention. These are higher level skills. So I have some examples of cancellation tasks here. This is more complex, but other tasks that would be good for lower level would be completing this maze. This is a higher level task, working on selective attention with answering those problems. This would be visual scanning, but also selective attention. This is alternating attention. So you're trying to find all the tasks that would go with oil changes, but there are distractor tasks in here, and so you're trying to stay on task with what we need to do for oil change. Another example, but with how to clean fresh sheets. Here's a divided attention task, just drawing a line in ascending order in order to connect the letters and numbers, alternating back and forth. This would be an auditory attention task, selective attention, another selective attention task, and we'll move on to orientation. So basic orientation would be things like orienting someone to the name tags and having them use their visual aids around them, a calendar, orienting them to their call button and where it is and when they can use it, other functional objects in the room. These are all the things I've flagged for somebody who is very low level. Finding out their room number and orienting them to their daily schedule. Okay, so I also have some more complex calendar tasks in here, where you can give them multiple choice or open-ended questions. To-do lists, more calendars, more to-do lists. I've got 10 of those activities here. A map, again, orientation. Okay, now we're moving on to memory. So memory, simple memory task would be to read a book, right? And then do immediate recall questions. Also teaching them of external visual aids, any kind of external memory strategy like writing things down, calendars, things like that. We can use memory book. I have an example of a memory book in here. Calendar, electric memo devices. You can do delayed recall activities, temporal spatial training for specific functional things that they need to remember. Functional memory sequences, these are tasks, all types of tasks that you can have somebody use or remember to use, and they can use their memory book to help remember this, but these are things that they would do throughout their week to apply what we're working on in therapy. And here's an example of a memory book. I also have a handout here for just some external memory strategies. I also have some reading passages, just different levels of reading passages that can be done for immediate recall. Okay, visual spatial recall. I have a couple activities here. So again, having them look at a picture and ask some questions. Calendar. This is following written oral instructions. So it's working on memory but also visual spatial awareness. Again with this one. This is a more simple task just like our first one. Again, open-ended or multiple choice questions. Here's another. This would be good for someone who has visual neglect on one side. Again, these are all more activities for visual neglect. Just orienting them to both sides of the page. Same thing with some of these questions that I have here. A couple activities, mazes. This can also have them scan the whole page. Lots of these activities overlap, I found. So, got a couple of those. Okay, so deductive reasoning. I have analogies. So I have analogies. I have riddles. More analogies. We've got some of these deductive reasoning puzzles. I've got a ton of those deductive reasoning puzzles for all different levels. Some problem-solving questions. Improving product or event. These are all problem-solving. Abstract reasoning. More clues for word deduction. And then this is again some more problem solving. Actually, this would be word association, so it's more thought organization. You can also play Scrabble. This works on memory. It's sequencing, but also remembering the words if you're going to give it to them aloud. Here's some more sequencing tasks. And you can use sequencing cards. Sequencing again with your calendar. Sequencing different things based off of category. And then more thought organization, kind of like Scrabble, but coming up with words like boggle, I guess. And just some blank templates for to-do lists. And lastly, I have, this would be problem solving, just very functional things, looking at different things that they might see in everyday life. Doctor's appointments, balancing checks, looking at going grocery shopping and thinking about money scenarios, tip cards, nutritional facts.